Aid workers in Yemen say more than 2 million children in the country are now acutely malnourished. The UN's children's agency, UNICEF, also says at least one child in Yemen dies every 10 minutes because of a preventable disease. Dr. Sherin is the deputy representative for UNICEF in Yemen and joins us now from Sana'a. Dr. Varki, thank you very much for your time. Can you tell us what your job has brought you face to face with while you've been around Yemen?
Thank you, Adnan, for having me. Well, the situation in Yemen is really dire, and even as we speak, especially children and women are facing a downward spiral. More than 2.2 million children are facing acute malnutrition, and almost 500,000 of them are severely malnourished. The situation is further complicated by a health system which is almost on the verge of collapse. Health workers have not been paid, and it has been extremely difficult for UNICEF and other partners to deliver aid and essential life-saving interventions to children and women across the country.
Do you believe, I completely understand that UNICEF is not a political organization, but is there evidence, do you think, that healthcare and the denial of healthcare is being used as a weapon of war in this civil conflict?
The conflict has definitely impacted the delivery of health services. As you may be aware, less than a third of the country's population has access to medical care, and less than half of the country's health facilities are functional. This is making it extremely difficult for women and children to access care. A cessation of the conflict will of course be welcome, but the real concern today is the crisis children and women of Yemen are facing today. It is important to make sure that life-saving interventions and care are brought to women and children in the corners of the country, as well as ensuring that the health system is protected and preserved from a total collapse. A simple life-saving intervention like a packet of RUTF can do wonders in saving the lives of children today. And it is important that the international community, while it works to ensure the cessation of conflict, also ensures that Yemen, the country, has enough resources, and the global and the partners here have the means and resources to ensure that these life-saving products and interventions are brought to the women and children.
Dr. Varki, just briefly, you really are raising the next point I wanted to make, is that if the international community is going to get involved from what you think people need or what you say people need, would those facilities, those resources even be allowed to reach the people who need it most? Because it's a civil conflict, are certain areas completely barred from receiving any assistance?
Yes, this is a challenge, and by all means, it is difficult to ensure that services reach in the farthest corners. But there are mechanisms. UNICEF with partners are working on alternate means, like using mobile teams, using outreach teams, in ensuring that people, even in areas affected with conflict, do receive the necessary care and services. This is an ongoing challenge, and it really needs all the partners and the global community to come together to work for solutions for the women and children of Yemen. The important issue to note is that the situation is extremely dire. Even as we speak, one child dies every 10 minutes in Yemen. This is a startling fact, which I think everybody needs to pay heed. We cannot wait for tomorrow. The time to act is now.
Dr. Sherin of UNICEF, thank you very much indeed for speaking to us from Yemen.